Okay, so we've heard some great insights about the use of data, and what we're going to do now is we'll jump back into the healthcare field, but in particular, we're going to look at a particular use case of analytics in healthcare. So I'd like to invite Dr. Nashya Haider to share with us. Welcome, Nashya. I'm great, thanks. So I'm really keen to learn, dig deeper into this particular challenge that you've identified, which can be addressed by the use of analytics. So I'll just check that your screen is coming up okay. Okay, that's perfect. Over to you.
Thank you so much, John. Is the sound good?
The sound is okay. It could be a little, maybe just a little closer to the microphone, I think.
Is that better now?
That's good. That's great.
Good. That's good. Okay, that's great. Good afternoon, everyone. Thank you, John, and the organizers at Apidays for inviting me to this fabulous conference. My name is Nashya Haider, and I represent Innotech Consultants. Today, I shall talk about analytics in healthcare, combating diabetes with data. Next slide, please. Diabetes is a global pandemic. An estimated 537 million people worldwide have diabetes, accounting for 12% of the world's health expenditures. And yet 1 in 2 persons remain undiagnosed and untreated. Both the number of cases and the prevalence of diabetes have been steadily increasing over the past few decades and is one of the leading causes of death worldwide. 1 in 10 adults around the world are currently living with diabetes. The total number is predicted to rise to 643 million by 2030 and to 783 million by 2045. An estimated 44% of adults living with diabetes are undiagnosed. Over 4 in 5 of these people live in low and middle income countries. Diabetes was responsible for an estimated $966 billion health expenditure in 2021 alone. What are the leading factors leading to an increase in diabetes in South Asia? Now, there's increased urbanization, sedentary lifestyles, and stress in big cities in countries such as India, leading to diabetes. So it's not only India. When I suggest South Asia, I'm talking about India, Bangladesh, Pakistan, Nepal, Sri Lanka. So 90 million adults are living with diabetes in South Asia region in 2021. This figure is estimated to increase to 113 million by 2030 and 152 million by 2045. 46 million adults living with diabetes in South Asia are undiagnosed. And according to the International Diabetes Federation, 47 million adults in South Asian region have impaired glucose tolerance, which means that they are at an increased risk of developing type 2 diabetes. And the number is projected to reach 59 million by 2030 and 77 million by 2045. So in 2021 alone, in the South Asia region, $10 billion was spent on healthcare for people with diabetes in the Indian subcontinent. Now, what happens in diabetes mellitus? So, in people with type 1 diabetes, the body does not make insulin. The immune system attacks and destroys the cells in the pancreas that make insulin. And type 1 diabetes is where people need to take insulin every day to stay alive. In type 2 diabetes, the body does not make use of insulin effectively. And this occurs mostly in middle-aged and older people. And type 2 diabetes is the most common type of diabetes worldwide. Diabetes cannot be completely cured, but its severity and symptoms can be managed by the use of diabetic medication, insulin therapy, and by continuous glucose monitoring using glucose meters, and by following a healthy diet, and by following also regular exercise. Now, what's the current status of what's the current situation of diabetes care during the COVID-19 pandemic? Now, this is the situation currently in developed countries. And what I'm proposing is that perhaps in India, one could also develop such a system in certain cities where you would be using continuous glucose monitoring devices, and the data would then be transmitted from the sensor to a receiver on your smartphone. And from a smartphone, the sensor glucose data can be transferred to the cloud, and from there to real-time followers, for example, healthcare providers in an endocrine team in a clinic or hospital, as well as to dashboard software such as LibraView from Abbott or Dexcom Clarity for comprehensive assessment of multiple patients. And then the comprehensive glucose reports can be scanned and uploaded to the chart. And until more data on the reliability of such inpatient continuous glucose monitoring are available, a hybrid approach is recommended, which means that one should also do blood tests to monitor your blood sugar levels. And in the market, especially in developed countries, there are lots of continuous glucose monitoring devices already available, which are approved by agencies such as the FDA. And the next generation of smartwatches, which are being developed for glucose monitoring, such as the Apple Watch, are products in development currently. And yet there is a big technology and process difference between medical devices which are already available and consumer electronic wearables such as the Apple Watch that are still in product development. Now, what are the healthcare trends that are driving the change to adopting new processes? Healthcare systems, especially in countries such as India, Bangladesh, Pakistan, are already overloaded. And with the growth of chronic diseases such as diabetes, associated heart disease, and kidney disease, it will be overloaded even more year by year. Hence, developing countries are by necessity moving to preventative care rather than treatment. And healthcare is moving from hospitals to home care and smaller clinics. And it's all about changing the mindset of patients to empower them to look after their own healthcare and to look after their own well-being. So it's about moving from curing a disease to preventative wellness. And how can artificial intelligence offer promise in diabetic care? So the purpose is to better understand what AI advances may be relevant today to persons with diabetes, their clinicians, family, and caregivers. And a diverse and complex set of innovative approaches that aim to transform diabetic care management are becoming more and more available in the marketplace today. Now, let me drill down a little bit more and look at the promises of AI in diabetic management. The data collected from all of these sensor devices means there will be a massive data set to enable AI predictive solutions. So, for example, if I were pre-diabetic, the healthcare assisted AI platform would be able to assess and foresee the risk development by myself by tracking certain social health determinants via biometric data. And thereby, I, as a patient, would be able to take preventative measures. This data would then be transferred to a single digital infrastructure linked to specialized clinics, and there would be real-time monitoring available. And then through APIs, you'd be able to send that data to the patient and to the endocrine team in a clinic or hospital, whereby they would be able to automatically produce weekly reports with regards to your glucose levels. And this would thereby also enrich the staff-patient interaction, because you'd be monitoring this on a weekly basis or a daily basis, and it would enhance that staff-patient interaction and also enrich staff workflows and reduce the burden on the healthcare system and on practitioners. Now, although there are lots of benefits, what are the potential challenges? There are many, many obstacles, unfortunately, to AI and disruptive technology adoption. One main aspect is development costs and the access to clean data for AI solutions, the access to and another major aspect that is important to highlight is the healthcare arena is very conservative. I'm sure the investment in the design, deployment, and development of such AI platforms needs justification. So it's not only a matter about financial return, but it's also about winning stakeholders who would be willing to come on board onto the project. For example, winning stakeholders such as medical practitioners, hospital finance and administration, medical insurance companies, practitioner insurance companies. And then the medical system is always concerned about medical ethics, data privacy and security, and the legal and compliance issues that may arise. And in AI, the data needs to flow and be exchanged, creating perhaps issues around medical data records and the privacy of medical data records. Then finally, any good disruptive technology will need process re-engineering and capability upgrading in terms of skills for the practitioners in the healthcare system and in terms of capability upgrading within the hospital platforms and systems. For all aspects of disruptive technology, there are fears and concerns that must also be managed across all people of influence. So this creates an interesting dynamic between the relationship of the practitioner, the insurance company, and the patient. And one needs to question, who is the payer? Is it the health insurance company? Is it the patient? or is it the government health service system? And the practitioner usually favors regulated, approved medical devices and frowns upon consumer wearables. The patient wants to be empowered and own their data and their life, and so is thrilled by wearables and other personal wellness devices. And the insurance company wishes to minimize medical costs, so favors prevention over cure. However, in terms of medical data, one needs to clarify that healthcare data needs to be protected through the HIPAA regulations. And so we need to ensure the confidentiality, the integrity, and the availability of all the data that's available. And this data needs to be maintained and transmitted over a very secure and encrypted system so that one can protect against anticipated threats, and one needs to basically ensure that all the data that's provided is protected in this sort of encrypted fashion. Now, I just wanted to highlight something, is that AI technologies applied to diabetic education mainly focuses on diabetic prediction, lifestyle guidance, insulin injection guidance, and blood sugar monitoring and self-management monitoring. So this is a enclosed system that is being proposed for diabetes education and management with the use of AI. And I'd like to highlight a case study from Spain, which is quite interesting, from a company called Medexin. And Medexin has developed an AI software, and it's driven by a predictive algorithm that's based on a set of data from persons with type 1 diabetes. This software would only is intended to give patients more control so that they can anticipate in advance in case their glucose levels go up and down to dangerous levels. And the data collected and used by the software developers are biometric data, for example, blood glucose measurements throughout the day, so in milligrams per deciliter. And these are also, they also measure how much carbohydrate you're eating every day, and the amount or dose of insulin that's injected either manually or by insulin pump. And they are also measuring how much daily exercise the patient is doing and how much time is being allocated for this. And using all these biometric data, they have come up with a wonderful software which then enables the patient to better control their chronic disease. Now, this is a product in develop at the moment, and I was just wishing to highlight this case study because this type of case study could also be done within a huge population in India. Perhaps there's a capability of doing a partnership with Medexin and introducing them into the Indian healthcare space within perhaps the private healthcare space. And to end my talk, I would like to actually call to action. This is my call to action for the API community today, the API audience today, is to join the game now to build a connected virtual ecosystem for diabetic care and management. So it's basically to build an infrastructure with APIs that will enable the patient to transfer data, which is controlled by them to their healthcare providers via telehealth portals or via APIs to their endocrine team in their local GP and to their social support group within diabetic forums. And they could also send this data perhaps to their dietitian, who then aids in maintaining a healthy lifestyle and healthy, balanced diet. So, this is the type of ideal virtual ecosystem that I'm proposing for diabetic management, and one where it could be an infrastructure built within a private hospital, such as perhaps Apollo Hospital. So it's quite an interesting proposition from Innotech consultants today. So thank you very much for your time and attention. And if there are any questions, please, I'm willing to answer them.
Thanks very much, Nashya, for sharing that. So I guess I have a couple of thoughts. So
Yes.
what? So you're talking about a very real health need, and
Yes.
also a more predictive approach rather than a reactive one, using data. And of course, that data has to come from somewhere. So there are different devices that need to be need to measure glucose levels, and and other parameters, and that data needs to be collected and shared to people who can make decisions. Some of those people are the patients themselves, who need to manage their own care, and some cases they are medical specialists, and in there is also an education element to this. I think that people who have this condition need to be educated on the best way to manage that, and it's not just a matter of eat less sugar. It's a whole holistic diet, exercise, and other activities that in order to manage it effectively. So it does require an ecosystem. It's not just collecting a bunch of data. It's
Yeah.
bringing that to the right people, because it's to do with patient health. It needs to be secure as well, and only authorized people can access that. So I guess this is we should have put you in the partner ecosystems track, because this is all requires an ecosystem approach to address it. But thanks very much for sharing.
Thank you very much. I just wanted to highlight that in the Indian subcontinent, so that Bangladesh, for example, I originally come from Bangladesh, there's a huge penetration of mobile phone devices in the millions, in the hundreds of millions. And so perhaps one could also partner with local telco companies in these markets, who could, private companies such as Grameen, private companies such as Robi, they can partner with the healthcare providers who are perhaps the private healthcare providers, in order to devise such platforms for the localized market. You can't just bring in technology from abroad. It has to be homegrown, and something that's relevant for the localized market. So I think there could be this synergy of developing it between healthcare providers and the telco providers in these markets. There could
Yeah,
be avenues that way.
yeah, definitely. Okay, well, thanks very much,
Thank you
Nashya.
very much. Thank you very much, John, for the opportunity.